morning. Our presentation is about the specific low back pain, and we have taken a look about the manual mobilizations, manipulations, compared to the exercise management. We found two articles for that, and with that we have made a case, a fake case, but it's a case that will fit by our clinical question. Some topics about our case. It's a woman, 55 years old, sporty woman, and have more than 6 months of complaints at her low back. Some friends of her has also complained at the low back for a while ago, and the therapist where she's going, he said manipulations are very good by this kind of complaints that you have on your low back pain. But their friends have said, by our therapist we have worked with some exercise management, and our woman doesn't know what's the best, and that's what our question is. Our clinical question is then, what's the effect of using segmental and regional manipulations of the low back compared to exercise therapy of the low back to reduce pain complaints in patients of 45 years old?
Yeah, so therefore in the methods we explain the pico question for the patient, female of 45 years old, which is sportive with low back. The intervention is the manipulation segmental or regional. Why I'm doing myself. The comparison is the exercise management. Comparison exercise management and the low back, and the outcome will be which is more effective to reduce complaint, either the manual therapy or the exercise management in the patient of 45 years old. So our database, we did a Google Scholar, PubMed, and for search word we did manual therapy, exercise management, low back, and we wanted also to exclude out any kind of surgeries, intervention, or post-operative treatment. And therefore we go for the results of our articles. That's made out with our PICO question. So from the results of 2 articles.
Yeah, we have the 2 articles. The first one, it's more about the manipulation, and the last one is the first one was about the manipulation compared to exercise management, and this one had also manual therapy compared to a conventional way of physiotherapy. And the conventional way of therapy is a bit wide, but the specific on in the article was conventional therapy means also exercise therapy, but it was with a McKenzie method. The McKenzie method is also exercise management, but not exercise management like the way on the first article from Osman Uber. But we have compare each exercise management compared to each other, and there are not that big difference that we say then we can use that article. From that we have used also that article from Chiaozing and Krikoukias. Here can you say the results. The results are based on the VAS in rest and VAS in activity, and you can here see the interventions and what the pain before was and after the treatment, and you see the p-scores under the 0.5 and the p-value, and also here in activity you can see the p-value is under the 0.5, and it will be significant. It will be better when you use a manipulation use manipulations by complaints at your low back, and it's the same here you can see the
On
table of the
second
criteria.
article, yeah, we compare manual therapy with conventional physiotherapy, so again exercise, stretching, and also use of TENS in the low back, and the sham treatment. The sham treatment was only applying PR pressure for 20 minutes once a week, so they found that basically sham treatment didn't do much in the patient, so most effective was manual therapy, so passive intervertebral manipulation, apply for 10 minutes in 5 sessions.
It was more like a placebo.
Yeah.
Sham treatment.
And then the conventional therapy. So they have the 3 groups: manual therapy, sham treatment, and the conventional therapy, and they use numeric pain rating scale, the OS3 and Roland Morris, which are both questionnaires based on quality of life. So they compare the 3 of them, and then they use it as pre-treatment and post-treatment, and the main difference was with manual therapy and conventional physiotherapy.
To get once back to the first table, I explained that the spinal mobilization manual therapy will be that the manual therapy have better results. That's true. As I manual therapy, spinal stabilization, this mobilization at your low back, have the same results in the rest of the time for the treatment. Yeah. Tommy, can you do the discussion?
Yes. We looked for articles, and we used the brain assessment to look if it suits with our PICO question and if it's a good quality the article itself. And if we assessed the article, we can conclude the articles, and that in both in articles from Kekukias, that the manual therapy exercise had better improvement in patients with a high degree of degeneration, and exercise management was better for patients with a lower degree of disc degenerations. It both the good effects, so you cannot say that one is better for the other, but it works for both groups, so that was nice to see. And if you look at the Osland-Ulger article, you can see that manual therapy had a greater effect for pain relief and quality of life, but that was only for a quick fix, so a short time period. Because if you look at the 12-month follow-up, you can see that the exercise management and some of the lifting exercises had a better effect on if you long-term effect. So it's because the manual therapy is quite passive. So you let the physical therapist do all the work, and you don't have to do anything. But you can't do that for a year long. So working out is a more active lifestyle, so it's better for long term. We also looked at the limitations of both the articles, and the limitation of the article from Kikukias is that there's a lack in education for home programs. So if you want to make it long term, they had to incorporate some education, which they didn't. That was a limitation of that article. And the article Osland-Ulger describes that they had no interval assessments, so they could not make a conclusion on the short term. And if they had those interval assessments, there would be results and rich results in the research. So articles. The conclusion is that manual therapy and exercise management had similar effects in reducing the pain improving quality of life. And we also said a combination of both is actually the best. So and would be the most efficient for patients between 20 and 70 years old. Yeah, that's what we came up with.
Yeah, and important to say is, as first when you start with manipulations from your low back, it will be nice for the patient, but it's a quick fix when you combine, also what Tony said, when you combine two interventions, this manipulation is first, and on the long term you start with exercise management, it will have a nice effect of your quality of life, and that's can you see also in the results by both articles.
Yeah, for the long term, and also including the education home program, so then the patient can still do it when return home and not will be having that placebo effect that only the physio is fixing the problem. And at the end we look for efficient between patients and 20 and 70 years old, because that was the age range in the found in both articles.
Yes. Any questions?
Yeah, was the manipulation in both articles regional or segmental?
Both. First, they used PA pressure as for the manipulation or the mobilization?
Sorry, mobilization.
Mobilization, it was PA pressure on, I think, L2, L3, and that was by both articles.
Yeah, the sham treatment was literally like PA pressure, the patient laying down and was PA pressure for 10 minutes, which wasn't really effective. But the manual therapy was more intervertebral segmental passive mobilization, so it was more segmental.
The exercise management was not only your back or the exercise management
Also for
was
the
also
lower
the
limbs.
transversus muscle where they use for the stabilization.
They also include in the Kirkovia's article, the exercise therapy was also doing some tense and static stretching for the hamstrings. Mainly because of the postural problem, if you are standing like this, then they will also include some stretching.
All right.
No questions?
No, some questions first.
It was quite a clear presentation.
Yeah.
Critical remarks.
Yeah. Do you want to directly give each one feedback, or do you want to do it afterwards?
We can do it now, I think.
Yeah.
Yeah.
I think it's very clear presentation. It's nice that you have the results in there. We did it a bit different, but you'll see
Yeah.
in a minute. But I think you did quite well by keeping it close to yourself. So your question instead of we get it written articles, but I think this is quite clear on the question you had. I think you did a good job.
Thanks. Nice.
Thank you.
Go to yours.